name's Tim Williams. I'm a GP and Director of Peak Health Coaching, and what I feel most passionate about is connecting people with what really matters to them so they can do more of what they love. I started at the pain clinic, and the reason for that was because I found people with persistent pain the most difficult to deal with. Even seeing their name on my list was enough to make my heart sink. So I thought, well, I'll go to the pain clinic and I'll learn all about dealing with people with persistent pain, and maybe I'll be able to help them a little bit more. And what I found was that the people who did well were those who realised that they had a contribution to make. And in some ways, it didn't matter what I did after that. Once they realised that they had a contribution to make, my job was much more about helping them tap into that internal resource and find their own way to respond to their long-term condition. So during the training, what we're attempting to do is to create an environment for people to think well. And what we know is that one way that people think well is welcoming diversity in their thinking. And on our courses, what we do is welcome people from lots of diverse backgrounds, whether they be patient champions or people working in the community, therapy services, hospital and community services, so that we can learn from each other. And that creates a fantastic thinking environment so that we can think better about the care that we deliver when we go back to our workplaces. And what we want to do is for people to take from our courses things that they can put into practice straight away. So this isn't just theory, this is something that you can use the very next day with the very next person that you see. A coaching conversation seeks to identify what's really important for the person. And it seeks to find what's not only important for them, but also what's going on now, and also what they want in the future. And once you know where your starting point is, and once you know where you want to get to, then actually with the help of a coach, people can then work out the steps that they might need in order to get there. And that is essentially a coaching conversation. Yeah, I think the unique thing about Peak Health Coaching is their ability to bring our clinical experience of people who are working still in the NHS and can bring real life examples to the theoretical concepts that we're getting across to people. And I think there's something about people who are working in the system, educating and training people who are also working in the system, which lands particularly well. And I think that's what Peak Health Coaching offers. So one of the benefits of having been a GP over the past couple of decades is I've had lots and lots of experience of people who have been struggling, but also those people who have succeeded in making lifestyle changes. And what I've been able to do is to piece together what are those common themes which allow people to kind of, or help people to make those lifestyle changes for the better. And that's really what's become the Stop It, Do It model that we at Peak Health Coaching train on. We train on a number of other models as well, but we found that particular model a really straightforward and easy to use model for our healthcare colleagues.